In this video, I'm going to demonstrate the surgical scrub of the patient. So we have our patient that's been transported from the prep area into the operating room, put on the operating table, and secured using these ties. The ties are important to provide stability of the patient so that they're not rolling around. For the scrub, I'm using a chlorhexidine solution. And for the rinse, I'm using a combination of alcohol and water. And I've poured each of these into a container with gauze and soaked them. And that's going to be our scrub solution. I'm going to wear exam gloves for the actual scrub. In my one hand, I'm going to use for retrieving the gauze out of the bowl, and my other hand is going to be used for scrubbing. The reason for doing it this way is, as I'm scrubbing, I have the potential of contaminating my fingers, and I don't want to transfer that back into the bowl. So what I'm going to do, I'm going to use my right hand, I'm going to take several gauze out, I'm going to transfer it to my left hand, and actually what I'm going to do is I'm going to squeeze out a lot of the scrub soap. I'm going to get it on the surface. I'm going to put it right at the area that I'm anticipating making my incision. And once it's on there, I'm now going to make circles around. These circles get wider and wider, and when I reach the periphery of my surgical field, I'm going to discard the gauze. Next, I'm going to take some rinse solution, transfer it, and I'm going to do the same thing. Notice that I'm not scrubbing back and forth, and I'm not pressing too hard with either the scrub or the rinse. If you press too hard, you're simply going to create small abrasions, and that's going to make an environment that fosters infection. So I'm alternating between the scrub and the rinse. And this is not something that you want to rush because it's all about contact time. That's what kills most of the surface bacteria, is contact of the scrub on the skin. This whole process should take 3 to 5 minutes. And again, as I get out to the outside, I do not bring the same gauze back in towards my incision. It's not necessarily important how many times you do this. It's more about the time you spend doing it. And what you see on the gauze isn't necessarily an indication of how clean your patient is. Because some dogs have pigment in their skin, and as the skin exfoliates, it comes off on your gauze and it looks like dirt. So you're better off looking at the surface of the skin, make sure that there's no gross contamination, and work up a little bit of a lather. And that completes the surgical scrub. I'm going to take my gloves off. And I'm going to bring in our surgical packs. These packs are double wrapped, and I'm going to open up the outer wrap of these packs. This pack contains instruments, and they have tabs here for me to grasp as I open this up. I want to make sure that I don't contaminate this area, so I'll make sure that this wrap doesn't fall down onto my scrubbed area. I also have a linen pack. Now, many packs and the packs used in the third year surgery course, the linen is already in with the instruments, and so you will not have a separate pack. Linen packs are packed using one layer. So you open this up, and your linen is right there. So I'm holding this wrap, and I'm going to lay it on the surface just like that. And the last thing I'm going to open is a scalpel blade. And I'm going to drop it right here where it's very obvious, and the person who completes the opening knows exactly where it is. So now I'm all set to go do my surgeon scrub, get gowned and gloved, and open up the rest of the pack and start draping.